Good early morning. Take your pick. Gordon Causey, once again, talking about big surprise monkeypox. It's been about a week since I've done one of these, and at the time that when I did my last one, at that point, it wasn't yet known whether the World Health Organization was going to declare monkeypox a global health emergency, or to use I guess their proper term is a public health emergency of international concern. And Saturday, that declaration was made that yes, indeed, monkeypox is a global health emergency, a public health emergency of international concern. That again came out Saturday, and immediately there was some comments by individuals talking about the fact that they had a vote. They have a committee called the International Health Regulations Committee that had reconvened. They'd had a meeting back all the way on June 23rd. And I forget what day of the week that was, either a Monday or Tuesday. And on the Saturday following June 23rd, they announced the result of that meeting was that they had decided that at that juncture, monkeypox did not represent a public health emergency. Then they just had another meeting Thursday of last week. So about a week ago, they had a meeting again, reconvened this IHR, International Health Regulations Committee, and then they decided that yes, it is a public health emergency. However, that committee, I guess, has 15 members, and the membership voted 9-6 against declaring monkeypox a global health emergency. 9 members voted in favor, 9 voted against declaring it a public health emergency, 6 voted in favor. However, the head of the World Health Organization, Dr. Tedros, I can't pronounce his last 2 names, say Dr. Tedros, I guess you could say he invoked something of executive privilege, and he made the formal declaration that yes, indeed, monkeypox is a global health emergency. And it comes down, now some have pointed to that and said, well, it's not, because 9 members voted against it and only 6 voted in favor of it. So it's like science is now democracy, and it comes down to a vote. Facts don't care about the result of a vote. I would ask you to consider if you had 100 experts on geography convening in Europe in the year 1480 and debating whether or not there was a landmass beyond across the Atlantic Ocean. Is there an undiscovered continent? And if 75 voted against the existence of a continent, an unknown continent on the other side of the Atlantic, and only 25 voted in favor, would that mean that North America would have ceased to exist? Science isn't a vote. Science is not about consensus. Science is about facts. And different individuals will have different interpretations of the facts. So is monkeypox a public health emergency? According to, it's officially been declared as such by the World Health Organization, with, again, Dr. Tedros exercising what I will refer to as executive privilege. As the head of the World Health Organization, he more or less overruled the majority vote in declaring it a public health emergency. Now, what's interesting is that, so it's according to World Health, it's a global health emergency, but the United States has not declared it as such. And the United States has more confirmed cases than any country in the world right now. And yet they're not declaring it a public health emergency. Interestingly, though, and I've got the link to this article, Uh, the city of San Francisco has declared it a state of emergency. And there's an article that I've linked below from the San Francisco Gate, the Washington Post, the New York Times, the Chicago Tribune. San Francisco Gate is about as mainstream a publication as you're going to find. And the interesting thing is, I'm reading a quote from the mayor of San Francisco, and it quotes him as saying this: San Francisco showed during COVID that early action is essential for protecting public health, Mayor London Breed said in the release. The quote continues: "We know that this virus impacts everyone equally." I'm going to say that again. We know that this virus impacts everyone equally. That is present tense, is what he's speaking. We know that this virus impacts everyone equally. But we also know that those in our LGBTQ community are at greater risk right now. Well, so right now it doesn't impact everyone equally, even though it does. The contradictions on this are frustratingly normal. It goes on to say many people in our LGBTQ community are scared and frustrated. This local emergency will allow us to continue to support our most at risk while also better preparing for what's to come. So, does it affect everyone equally? Does it not affect everyone equally? Right now, and I think he speaks to this, he's sucking and blowing at the same time, saying we're all at the same amount of risk, but right now, it's the LGBTQ community who's most at risk. There's a lot of debate going on right now as to whether I grew up in an era when the term was STD, sexually transmitted disease. Now I understand the acronym is STI, which I'm assuming stands for sexually transmitted infection. And again, this is another one of these, areas where we get hung up on language, where the language gets so confusing. We're told that monkeypox is not an STI. You'll see that repeatedly in the media from health experts. They'll be telling us that monkeypox is not an STI. It is not a sexually transmitted infection. But they say, but it can be transmitted through intimate close contact, which obviously you don't get much more intimate and much closer than sex. So is it an infection that can be transmitted through sexual transmission? Is sexual transmission a mode of transmission for monkeypox? I think the obvious answer is yes. Is it the only manner in which it can be transmitted? I don't believe so, and I don't think any of the experts are saying anything different. They're saying that fomite transmission, like if a lot seems to be determined upon coming into contact with someone who has open sores, and those open sores are apparently highly infectious. So if someone has open sores and they are lying on a bed, and then the pus or whatever is in these postulates gets onto the bed sheets, shared by someone else, and that person can become infected. That mode of transmission is referred to as fomite, Fomite, which is something, fomite transmission is something they used to teach us about when we were 12 and 13 in grade 7 and 8 middle school health class. How if you wipe your nose and then touch a common surface, and then someone else goes and touches that same common surface and then touches their eyes, nose, or mouth, then they can get the whatever it is, be it the flu, be it any number, common cold. There are, and so my view is this is going to spread. Now, how far is it spreading right now? I looked up the numbers, and on May 31st, the number I'm seeing reported on that the number of identified confirmed cases on May 31st of this year was 749. By June 30th, so a month later, that number had jumped to 6,474. So over a 1 month period, the number of cases had increased, according to my calculator, 864%. Now, today is July 29th, and this reporting, I believe, was from Thursday, which was the 27th. The number was up to 21,125, which meant from June 30th until toward the end of July, but we still have a few days left in July, the numbers had grown 326%. So that would indicate that the rate of growth is maybe slowing, but the biggest qualifier in all of that is the testing piece. How widely are people being tested for monkeypox? And this is my understanding as per what I've read on the CDC, the direction that they're giving. That's the Center for Disease Control and Prevention in the United States. And I've read the same guidance coming from Public Health Agency of Canada, PHAC. And both are saying that before an individual to be tested for monkeypox, that they have to go into a healthcare provider and they have to be displaying a rash that is consistent with monkeypox. And the difficulty is that in the early stages, monkeypox can mirror a number of different diseases. There's one story I read about a gentleman who was experiencing fever, chills, muscle aches and pains, maybe some, diarrhea, whatever, went into the doctor and they did not test him for monkeypox. They tested him for COVID. And then he went home when the rash developed. Then he went back to the doctor and with the rash, and now having a rash, now they did a test for monkeypox, which was confirmed. Did he have monkeypox before? Yes, but they didn't test for it, so he wasn't a case until that rash developed. And it leads to the question of how many people are suffering from monkeypox who don't know it. And the low level of testing, I don't want to see us go into back to the COVID era where we had drive-in testing clinics where they were using this PCR test, swabbing up the nose, and then people with no symptoms whatsoever were determined to be a case. But at the same time, people going into the doctor displaying symptoms that are consistent with monkeypox but not exhibiting a rash are not tested for monkeypox. And so how underreported is the disease? It's an open question. My own back of the napkin projections that I made back sometime in June was I expected by the end of August, by the end of the summer, basically. For me, summer ends September 21st, but for me it ends August 31st. By the end of August, we'd be looking at somewhere in the neighborhood globally of 50 to 60,000 cases. And I think that by the end of September, that we're probably going to be looking at 500 to 600,000. And then by the end of the year, by the end of 2022, we'll be into the millions. That's my guess. And right now, we're being told that it's overwhelmingly impacting the LGBTQ community. I would like to know, and it's a question I don't think will ever be asked, is what is the jab status of everyone who's tested positive? I'd like to know, is it 100%? who have had at least 2 shots, if not 3 and 4, who are coming down with monkeypox, or is it reflective of the entire population? I think in the United States, they're in and around somewhere around 70% of the population has been vaccinated against COVID-19, have taken one of the COVID shots. I think the number I seem to recall is 67% who have had their two or more shots. So that's 33% who have not. But at the same time, I then read an article that had been published to JAMA, which is the Journal of the American Medical Association, and they had the rate of vaccination, people who had had their 2 COVID shots, in the white male gay community. They had it at 94%. And that was based on a survey of over 150,000 individuals between August and October of 2021. So I think it's reasonable to assume that if it was 94% in October of last year, that by now, that we're into July, coming into August of 2022, that 94 is probably even higher. Now, they broke it down by sexual identity or sexual preference and by race. And it would be white, black, Hispanic. And what they found that the rates of vaccination in the broader LGBT community were always higher than what you saw in the general population. There's a much higher uptake in the LGBT community, regardless of race. But it was highest among whites, a little lower among Hispanics, and slightly lower again among blacks. But I think that would mirror general society as well. And the rates of vaccination, according to the JAMA study, Journal of the American Medical Association, rates. So is there a connection? I don't think anyone will even look for it. Don't look, don't find. There have just been, it's been confirmed now that in the Toronto area, 5 doctors, with just in the month of July, 5 doctors have passed away. One was an Olympic sailor and died while out jogging. Then there were 3 with Trillium Health Partners, which is based in Mississauga area, and their deaths were not widely reported. They were only just confirmed in an article by Post Media by one of their columnists by the name of Joe Warmington. And Joe Warmington just went to air with another story of another death. And I think I believe it's a woman who was just 27 years of age. I'm just checking now on my social media feed because I shared the article from Post Media. Let's see if I can find it. Looking. Yeah, there it is. Triathlete, 27, becomes 5th GTA doctor to die in July. And that's headline date July 28, 2022. Triathlete Dr. Candace Naiman, a resident at McMaster Children's Hospital in Hamilton, so it's not Toronto, Hamilton, which is a city about an hour or so west of Toronto, collapsed during a recent training swim and died on Thursday, July 28th, 2022. And so that's, the headline says 5th GTA doctor to die in July. Hamilton, is that really part of the GTA? I'm not going to, they're very close. They're within an hour of each other. But Hamilton's a big city of around 500,000 people. So it's kind of a separate jurisdiction unto itself. It's not part of Toronto in my books. For me, the GTA starts in Oakville going west, and then it goes to Oshawa in the east, and up north, maybe to Vaughan. But leaving all that aside, in the last year or so, we're seeing a lot of issues coming up. I myself, unfortunately, sadly, I know too many. A former colleague of mine passed away from a heart attack. Wasn't even, I think it was around mid-40s. Died of a heart attack in his apartment building. Had a local town councillor from the town in which I live. He had a massive heart attack. Fortunately, he's still alive, as far as I know. I have a family member, 38-year-old, super fit, 6 foot tall, 180 pounds, had a heart attack. It's just too many of these stories. I also know of a friend who had a massive stroke. Another person I used to go to church with had a massive aneurysm. There's one common denominator with all of these, and I'll leave you to get what it is. And now, we're seeing 5 doctors in and around the Toronto area just within the month of July, young and healthy, an Olympic sailor and now a triathlete, 27. What's going to happen in the, then when you get back to the monkeypox piece, what happens in the fall when rates of viral transmission are believed to jump exponentially because we're all indoor, we're all spending a lot more time indoors, we're in closer quarters. I'm wondering, this is the politically sensitive end of it, but viruses don't care about politics, but viruses don't care about. That was one thing that was annoying during the COVID, what I'll call the COVID era, is that a large outdoor gathering in March, April, May of 2020 was not allowed because the virus. You're not allowed to have a large outdoor, even an outdoor public gathering. You can't have large numbers of people coming together. It can't happen. And then, in the wake of the George Floyd murder, there were huge, massive outdoor demonstrations, and then that was okay. Another famous contradiction that everyone knows about. You couldn't go to church, but you could go to Costco. You could go to work at an Amazon warehouse in the Toronto airport area, where the National Post reported one or more of their facilities that had outbreaks of 500 plus cases, but that was okay. So many contradictions. And now the mainstream media is reporting that overwhelmingly that monkeypox cases are being identified in men who are engaging in high-risk sexual behavior with other men. So will public health officials maybe determine that they should shut down bathhouses? Well, I don't think so, because this isn't medical, this is politics. And we saw the same thing at the start of COVID from the very beginning. Countries like New Zealand, Australia, and the United States in February of 2020 started putting restrictions on international travel and having people come into their countries from places like Wuhan, China, and Italy, and others, I think Iran, where there had been large outbreaks. But in Canada, we did not institute any restrictions on incoming travel because our chief medical health officer, Dr. Theresa Tam, did not. She said it the risk of stigmatizing certain populations, certain groups. We don't want to stigmatize people. Well, does the virus care? Does any virus care? So trying to make head or tail of public health guidance and everything is very challenging in this era, because politics has stuck its nose right into it, and it's been there from the very beginning, and it's continuing now with monkeypox. You have the mayor of San Francisco who can't decide whether it is impacting everyone the same, or if is it impacting everyone the same, or is it impacting the LGBTQ community more? Well, his answer seems to be yes on both counts. Which is it? Is it impacting LGBTQ more, or is it impacting everyone the same? Which of those two boxes are you going to pick? And he says yes to both. So, it's just ridiculous, the messaging that's going out on this. I keep vacillating on whether or not there are going to be, mandates like we've seen in the past. The face diapers, those lovely, unhygienic, disgusting rags that people put over their faces that nobody handles, like medical PPE, as they're meant to be. They're meant to be handled in a sterile fashion, which nobody does. I was talking to a gentleman at my son's soccer game just this week, and he was talking about how, what a joke it is. He goes to a gym where they require it, but not when you're actually working out. So, you're standing there on the whatever machine you're doing, and the mask is off, stuffed in your sweaty pocket, and then when you get up to go from that machine, then you put it on. Oh yeah, just the same way doctors operate in ORs. When they step away, they take their mask off, stuff it in their pocket, pull it back out with ungloved hands. Doesn't happen. So anyway, that's all I have to say on the matter for now. I'm sorry I didn't get this out when they first declared it a public health emergency. When they had the first meeting June 23rd, I was expecting that one to be declared an emergency at that point, but it wasn't. Although I did say, if they don't, I said, I won't fall off my chair. I think they will, but I won't be shocked if they don't. But then when they had the second meeting, I said I would fall off my chair if they didn't declare it one. So I don't have to fall off my chair. I got that one. I was confident they were going to, highly confident, and they did. What's going to happen? The biggest question is the testing piece. If they start doing widespread testing where people, all they need to do is come in presenting symptoms consistent with monkeypox, whether with or without a rash, if they start testing people. But the only thing is, because of the messaging on monkeypox, and because now the common perception is that monkeypox is a disease that spreads primarily through sexual activity, and in particular, men having sex with men. There are two issues there. Someone who is genuinely not engaging in sex, having sexual, a guy who's genuinely not engaging in having sexual activity with men, who starts to experience symptoms consistent with monkeypox and maybe even the rash itself. Is that individual going to go and get tested, or are they going to try and tough it out with Advil and Tylenol or whatever pain medications they can access over the counter themselves, because for fear of being stigmatized? And likewise, are there gay guys still in the closet? Yeah, I'm 100% sure of that. I'm sure there are guys leading double lives. I'm sure there are guys who are married who engage, go to a bathhouse or whatever the case, And if that person comes down, if that guy comes down with monkeypox, is he going to rush out to get a test and risk being potentially outed? And I think there's a significant amount of underreporting. Right now, we're being told it's 22,000 cases globally. Is it, how much higher is it? That I think that's my own personal non-expert view is it's the tip of the iceberg. I think we're probably already in the hundreds of thousands of cases. They're just not being reported. And I would invite you again, I've mentioned this before, look into the Nuclear Threat Initiative, NTI.org, and look into their monkeypox scenario. They did a tabletop scenario in Munich, Germany, back in May of 2021. And there they put forth a scenario, a hypothetical scenario about an engineered version of monkeypox being released into the human population by a terrorist group or country, and that this variant, this engineered version of monkeypox, that it would be vaccine resistant. That was their tabletop exercise hypothetical scenario. And look at where they had the world at in by May of 2023. I believe, going off memory, they had globally 70 odd million cases and millions of deaths resulting from monkeypox. Will that happen? My crystal ball is broken. What I have read, numerous accounts, is that the pain from the sores, from the rash, like shingles, that the pain can be, and I quote, excruciating. People will say, well, monkeypox is not a deadly disease. Well, look at all the people who've recovered from COVID, who would say to you that, well, COVID, how deadly is it? Tons of people are fully recovered. Now, tons of people keep getting infected and reinfected and reinfected and reinfected. But look at our Prime Minister in Canada. But I ask the question, what is their status? How many have they had? And is that potentially a factor in the reason why they keep getting reinfected and reinfected? I don't know. I'm just asking the question. So leave you at that. Have a good night, everyone.